Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. For those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one on one sessions, Q banks, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. So, we're continuing with our antibiotic series, just trying to help y'all see it and apply it throughout each system so that you can build this material because I received so many questions on antibiotics. So, if you missed any of the other ones, go back and look at the few that we have done so far. But let's get into the ones for today. Question number one states the nurse practitioner has diagnosed a 43-year-old patient with community acquired pneumonia. What is the first line treatment option? Is it A, ciprofloxacin, B, Bactrim, C, azithromycin, or D, augmentin? Take a moment and tell me what you got in the comments, you guys. Now, y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure that you're answering what is even being asked of you. The stem of the question here states, what is the first line treatment option? Now, two things. Is asking for the first line treatment. So you need to know initially what you do. But secondly, I always tell you if it's asking for a treatment, you need to run it back and see if they have provided you with a diagnosis. If they have, then you can proceed with your treatment options. If they have not, you need to run it back a step further and look at the assessment findings so that you're able to narrow down and determine what the diagnosis is to then be able to treat, right? So here they have provided you with the diagnosis. The patient has been diagnosed with community acquired pneumonia. What is that first line therapy? And the best answer here is C, azithromycin. Now, this is someone who is 43 years of age, so they are a young adult. They don't have any comorbidities listed, so you can utilize monotherapy, meaning one treatment option. So you can do your azithromycin as your macrolide, who has been proven to be the top of the first line therapies for the guidelines for community acquired pneumonia. Also, sometimes they'll say that you can utilize amoxicillin for that monotherapy. They won't have those two listed together on the exam. So make sure if you see one or the other, then you know these, but macrolide is the top of the top for that monotherapy, okay? Question number two, the nurse practitioner is treating the patient with community acquired pneumonia. The patient is 43 years old with a history of hypertension, diabetes, and COPD. What is the best first line therapy? Is it A, amoxicillin, B, Bactrim plus amoxicillin, C, azithromycin plus amoxicillin, or D, doxycycline? Tell me what you got. All right, so stem of the question, what is the best first line therapy? So same thing, we're looking for the first line, we're looking for a treatment. So treatment, we want to determine if they provided us with a diagnosis, and they have. This patient has community acquired pneumonia. They're 43 years old, have a history of hypertension, diabetes, and COPD. Now here, you want to do dual therapy. When a patient has comorbidities, you want to go ahead and initiate first with dual therapy as it is found to be more effective than just monotherapy. One, and I want you to think of it like this. Pneumonia can be fatal to patients, right? Especially the elderly population and especially people with comorbidities. You want to uh, treat more aggressively, I should say, initially. So we try to go ahead and move forward with the dual therapy to provide better coverage. Um, for better results for people who are having the additional risk factors. So here you would go with C, azithromycin plus amoxicillin, okay, as the first line therapy. So when you're trying to figure out these questions, I want you to pay attention to their age, pay attention if they have comorbidities, and then determine, because a lot of you are getting hung up on, should you do the macrolide, should you do your amoxicillin? Oh, it says this plus this, but you're not paying attention to when you're doing this. Monotherapy are for those healthy young population. You go monotherapy, right? Just one thing, one medication. If it is a first line for someone, they could be young, but they have comorbidities, for example, like this one. So then you're going to do your macrolide plus the amoxicillin. That's going to be your first line therapy, okay? Now, question number 3. The patient returns to the office stating that he continues to have a cough with brownish colored sputum. He was treated for community acquired pneumonia 3 weeks ago. What is the best treatment at this time? Is it A, amoxicillin, B, levofloxacin, C, azithromycin, or D, cephalexin? Take a moment and tell me what you got. All right, and the stem of the question here, you guys. He was treated for acute. He was treated for community acquired pneumonia 3 weeks ago. What is the best treatment at this time? STEM truthfully was, what is the best treatment at this time? So typically, if it's saying what is the best treatment at this time, we know something must have been preceding this, right? So this patient was treated for community. I don't know why I can't say that today. Community acquired pneumonia for 3 weeks. I'm gonna get it together. He was treated for community acquired pneumonia 3 weeks ago, right? But the patient comes back in. He continues to have a cough, a brownish color sputum. Y'all know these is a classic presentation for CAP, right? Community acquired pneumonia. Remember, they're the ones that have those sudden symptoms with that rust colored sputum. So they have that productive cough, right? Whereas a typical pneumonia is gradual and a non productive cough. So this lets us know that they're still presenting with this community acquired pneumonia from a symptomatic basis, where they were treated 3 weeks ago. So you want to go to the big guns, because remember, when we're treating pneumonia, if they have those comorbidities, they're elderly or DRSP, you go directly to the respiratory fluoroquinolones as the big guns, right, to treat. So this is a scenario where you would do that because they have been on antibiotics within the last 30 days, and we like to ask if they have been on it in the last 90. So this is even sooner. So your best choice here would be B, levofloxacin, because those are your respiratory fluoroquinolones, right? Remember, gemafloxacin, moxifloxacin, levofloxacin. Remember Brittany's brilliance, get my lungs, right? Because we're trying to get our lungs together, the respiratory fluoroquinolones. G for get, G for gemafloxacin, M for M for moxifloxacin, L for lungs, L for levofloxacin. So again, B is your best answer. All right, you guys, we'll continue our antibiotic series. As you can see, we are now in the respiratory section. And as we continue on, we'll work through the system so that you can kind of gauge it throughout all of the systems, okay? So, as always, I hope you found this helpful. Be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure to meet me back here. If you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Now, the things that I do offer are my review book. You can get it in the ebook or paperback option. They're both linked in the bio of this channel. If you are someone who prefers to review on your own, I do offer a online self-paced review broken down by system for family and adult general, designed for both exams. That is also linked in the bio of this channel. If you're looking for any of my QBank options, they're all linked in the bio of this channel. And lastly, I always say, if you're looking to book a one-on-one session, to always reach out, because they are customized for each review student. So I like to gauge what you truly need. But the one-on-one sessions are either designed based off a weakness. So you can book a 1 to 2 weaknesses per session. You can book an exam readiness assessment. You can book a question analysis assessment, or you can book the custom package where it is designed to work alongside with you over a duration of time based off of your study timeline that you're looking to prepare for boards. So if you need any of those things, like I said, feel free to reach out to the nursing studio. But as always, y'all make sure y'all meet me back here. Happy studying. Bye, y'all.